Welcome to the Mental Health Merienda, your snack-sized guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker. So for today's episode, we're going to be talking about the rising youth mental health crisis. So there have been a number of reports sounding the alarm about this issue. So here in the US, but also across the world. So just a few of the headlines that are highlighting this crisis in the last few years. So as a content warning, this episode does contain references to self-harm and suicide. So in 2021, the US Surgeon General published an advisory urging the critical need to address the youth mental health emergency, which has had the most significant impacts on marginalized young people. So we're talking about youth with disabilities, racial and ethnic minorities, and LGBTQ plus youth, or lesbian, gay, transsexual, queer youth.
And so the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatrists launched an initiative urging Congress to enact legislation and increase funding to address the youth mental health crisis. And they asked for this extra funding and this extra attention after realizing in their reports that children's hospitals had a 45% increase in the number of self-injury and suicide cases. And this is the part that I found so shocking in 5 to 17-year-olds compared to the same period in 2019. So as young as 5 years old.
Yeah. And I don't think people realize that mental health impacts across the lifespan, right? So even children as young as 5, I mean, I've seen children as young as 3 show some self-harm and depression and things like that. So yeah, it does happen across the lifespan. As we're talking about these headlines and advisories, it's really clear that there is this emphasis on the gravity of the youth mental health crisis. And it's actually been, the mental health of youth have actually been declining even before the pandemic. So things got worse with the COVID pandemic. But what we are seeing is that youth mental health have been on the decline. So according to another CDC report, so this is a report called the Youth Risk Behavior Survey. In this report, in the 10 years leading up to the pandemic, feelings of persistent sadness and hopelessness, as well as suicidal thoughts and behaviors, increased among teenagers about 40%. So this has been happening in the 10 years, even before the pandemic. The pandemic just highlighted how bad it is.
So that report that Michelle mentioned, it depicts higher rates of mental health challenges, specifically in marginalized groups, marginalized youth. For female students, almost 60% experience persistent feelings of sadness and hopelessness. And when you really take in that number, more than half reported that. And for LGBTQ plus students, close to 70% experienced persistent feelings of sadness and hopelessness, so even higher for that group. And 22% of students seriously considered attempting suicide, and 10% actually attempted suicide. I was really baffled by these numbers when I found these reports.
Yeah. And you're thinking how it just has gotten worse in 10 years. So again, not because of the pandemic, but then in the years leading up to it. I think that's really staggering.
It is. And so for female students, nearly 25% actually made a suicide plan. For LGBTQ plus students, almost 25% attempted suicide during the past year, and 45% seriously considered attempting suicide. So we can see that that's a far higher number than heterosexual students. And so there are really specific issues that LGBTQ plus students are facing, and it's something that is having a major impact on their mental health and actually causing many of them to attempt suicide. And Black students were more likely to attempt suicide than students of any other races and ethnicities. And there was one more statistic related to Hispanic youth, and this is from a 2022 National Healthcare Quality and Disparities Report. And that report found that the rate of suicide death for Hispanic youth increased by 2% between 2018 and 2020.
Yeah, I mean, all this is just really hard to process, like how there's something going on, especially with, marginalized youth, as you're saying. So modern society has created new and complex stressors for youth. So teens are spending a lot of time on social media and on their devices in general, but the answer is not to just take away their phones or just take away social media. That isn't the simple solution to solving the youth mental health crisis. So we do want to point out that social media does have some positive effects. And actually, it can help strengthen and even maintain social connections for youth. So, kids, that's how they are communicating with their friends. That's how they're able to stay in the know and know what's happening. That's part of their conversations with their peers. So I think just simply taking away social media or taking away their devices might actually have the negative effect of isolating your child. Wouldn't you say, Adeline?
Most definitely. Yeah. And, when I think about that, I think this is a very, very important point to emphasize. So Michelle and I would be considered geriatric millennials, I think is the term, or elder
Oh,
millennials. I don't like that term, but that's what we would be considered. And so we're in the generation where, I don't know about you, Michelle, but I got my first cell phone when I was about 18 is when I got my first one.
Yeah, I think 17, 18. Mm-hmm.
Yeah. And so at that time, so I was just right out of the house, but if I had gotten it just a year earlier, I would have been in high school still. And so if there were any issues about, my parents, wanting to have any disciplinary action against me, they could have taken away my phone. And I wouldn't have liked it, but it wouldn't have made me feel so isolated like it would now. So I think parents who are about our age, who have teenagers or maybe a bit older than us who have teenagers and they do that, they don't realize that for kids now, it's not like it was for us. This is their lifeline.
Right, right. And I'll say for the teenage clients that I see in my practice, I mean, when their parents take away their phone, their reaction is much more heightened there in terms of being upset, because it's not just that they took away, something of them, something of theirs that's important to them, but they're unable to talk to their friends, talk to maybe friends that they have that they've met on social media that might live further away. They don't know what's going on. So when they are in school talking to their friends and actually talk, with them in person, there's stuff that they're talking about that they're like, well, I don't know, because I don't have my phone, so I don't know what's going on, and it makes them feel like harder to engage with their friends. So I think it's really difficult, right? Like, it's not like the way it was when we were kids. It was not like it wasn't like that.
Not at all.
And there is this piece where it does foster that connection with some of their peers. So when you take that away, you're taking that connection away from them too.
Mm-hmm.
Yeah. As we're saying, so social is taking away someone's phone or taking away their Instagram or their accounts is not enough. It's not really the simple solution. But, social media usage does have to be supervised. That has to be moderated. And that's where we as parents come in. So there are a number of negative effects to social media that we know, because, it's been reported on. It's part of the cultural conversations. So some of the negative effects of social media, or spending too much time on social media and on your devices, would be spending less time with your peers in person. So spending that less time, that face-to-face time, can lead to loneliness, which I think, as we know, loneliness is a risk factor for poor mental health and physical health. Also, spending too much time on social media, on your devices, also puts youth at risk for not getting enough sleep. And that's actually a huge one. Not getting enough sleep, especially at this young age where their brains are rapidly developing, that can be linked to symptoms of depression and suicidal thoughts. And in general, sufficient sleep is crucial for brain development, and for youth can help them better manage their stress. So the sleep factor is very important.
And Michelle, you're a parent. And so what are some things that you've done with your children to help with moderating that? I think that's something that a lot of parents struggle with, on how to do that.
Well, one thing I think, and we'll talk about this as we get into, what are some ways we can address this with our own children, is, well, one is being connected to your child. So knowing your child. So I have an 11-year-old for some context. My child is kind of on the younger end of 11. So she's not on social media. So that's one thing. She's just not on social media right now. She doesn't really have time to be on social media. But I think just knowing her personality, knowing, who her friends are, I think I know her friends really well. I know her friends' parents. We're all friends. So in terms of, her texting, being on her phone, communicating with them, I'm able to very easily see what she's texting at any point, so that there's nothing that's being hidden from me. And then also just having that open communication that, having a phone is a privilege. And that, I just want to make sure I'm aware of what's going on. And then she's also telling me what's going on. But I know for some of my colleagues and friends who have older children, there are different apps out there that can help monitor, the texting and what your kids are looking at on their phone. There's one that comes to mind that's called the Bark app, where it will show you, it'll send you a message, if there's any keywords that is being said in a text chain, for example, like, oh, warning or alert, they might be talking about violence, or warning, they might be talking about drugs. And then you can go in then and look at those specific conversations to see if it's truly something you should be concerned about, or if it's just, some sort of like misunderstanding with the communication or the technology. But there are technology out there that is, and maybe that's another separate episode we can talk about. But there are like other technology guardrails that you can put up so that you do have more of that supervision of your children's devices.
I think that's really useful for us to know is exactly how to do that. But I think when we think about all of these mental health challenges, one thing that we can't ignore is the fact that access to mental health care, it really has presented, or inadequate access to mental health care, I should say, has presented significant obstacles.
Right. So what are some things that can be done to help prevent the negative mental health impacts on youth? So a key preventative measure is connectedness. So helping youth feel connected to school, to their families, or to their community, that significantly helps to protect youth from poor mental health outcomes and also prevent a whole range of negative experiences like experiencing drug use or violence. So connectedness is really key in making sure youth feel connected to something. So children who do feel like they belong in one or more areas of their lives tend to have better outcomes. They tend to feel better about themselves, and it helps them feel more secure. And I think this should come as no surprise to all of us as we're hearing this. But again, like, this is something that not everyone is feeling connected. So youth who do, again, feel connected to something in their lives, and the more things, the better. But they do better academically, they build friendships easier, and then they are more social. So this kind of makes me think of a really great quote. The quote that I love and I learned in grad school many, many years ago was, so every child needs at least one adult who is irrationally crazy about him or her. And I love that because that's how I feel about my children. I just love them so much. And every child needs that to help foster their development. So that quote comes from a child psychologist named Yuri Bronfenbrenner at Cornell University.
I really like that quote too. Just that thought about really the child feeling loved and feeling like they belong and feeling validated, I think is so important. And from what I'm hearing from you in that quote is that it really takes a concerted effort from parents to make sure that their children feel that way. It doesn't just happen.
Right.
Yeah. So when it comes to connectedness, families and caregivers play a critical role in that, which makes sense. They play a critical role in providing the safe, stable, and nurturing environment and relationships that young people need to thrive. So some things that families can do to help their children improve their mental health outcomes is be the best role model you can be by taking care of your own mental and physical health. And so young people, they learn behaviors and habits from what they see around them. We think sometimes they're not paying attention, especially when they're much younger, but they always take that all in. And so modeling good habits by talking to your children about the importance of mental health, seeking help when you need it, and showing positive ways that you deal with stress so that your children learn that from you. And so showing your children, a few ways that you could do that are showing your children that you value things like taking breaks, getting enough sleep, exercising, eating well, maintaining regular routines, staying connected with family and friends, and taking time to unplug from technology or social media. That's a very, very big one that many parents don't keep in mind. They're asking their kids to get off social media while they're scrolling on Facebook or Instagram. So you need to model that good behavior that you're asking your children to also do. Another thing that families and caregivers can do is help children and youth develop strong, safe, and stable relationships with you and with other supportive adults. So research shows that the most important thing a child needs to be resilient is a stable and committed relationship with a supportive adult. So you hear stories about children that have been through terrible adversities, foster care, and just so much. And they've been able to be resilient. And the research shows that oftentimes what contributes to that is that even though they might have had a very difficult family life, they had a teacher or a
Yeah, that
coach
one
or
person
a pastor,
passionately
maybe
crazy
someone.
about them.
Exactly. Someone who is that one person. So, of course, we hope that it's parents, but in children who are in unfortunate circumstances where they can't have that, if that's another adult, it really, really helps their outcomes. And so, spending time with children on activities that are meaningful to them, show them love and acceptance, praise them for things they do well, listen to them, communicate openly. Don't just criticize them and critique them. Also show them what they do well and validate that and show that you're listening to them. I'm not a parent myself, but I've witnessed many parents where their children are talking to them and they're kind of nodding along or just not even really looking at them and they're not paying attention. And so show them that you value their experience and that you care about what their lives are like and what they're going through.
Yeah, this is all kind of going back to that connectedness, right? When you are interested in what your kids have to say, what they're interested in, you're fostering that connectedness. And again, as
Mhm.
we said earlier, the more people they're connected to, I mean, again, having that one person who's irrationally crazy about you,
Mhm.
has proven effects to being resilient. But the more people who are also crazy about your child just means for better outcomes for them.
Right. Yeah, and so, on a related note to that, is encouraging your children to connect with other adults who can also serve as mentors. And so, your extended family, your friends, Michelle, your kids have called me Auntie Addie since they were. I don't know. Do they
Yeah,
still call me that? Maybe they're a
they
little too
do.
old for that, but they do. Oh,
They
it's
do.
like okay.
And they know funny stories about you. And yeah, they,
Yeah, yeah, we do. Yeah.
yeah.
So like that's a great example is that, making sure that they have those connections with you, your extended family, your friends as well. And then they can have lots of aunts and uncles by blood and not by blood.
Exactly. And I brought my kids to like our brunches and lunches when we were like visiting each other. So yeah, definitely. Um, it's definitely important to make sure that kids have that safe environment, that community, that village. I think we always hear it takes a village. It truly does. It truly does take a village to raise children. And so the more you can incorporate other healthy adults into your village, into your community, into your child's lives, I mean, the better outcomes for your child. So some other things that parents can also do is encourage your child to build healthy social relationships with their peers. So I think it's no surprise, or we all know this, that peers play a major role, both positive and negative, in a child's development. So it's really important for children to learn how to deal with peer pressure, with peer relationships, how to foster healthy relationships, how to communicate, how to set boundaries. So have open conversations with your child about their values, try to teach them to be confident, teach them to be comfortable in expressing their needs, their wants, setting boundaries again, because as we know, the peers, at some point when they get older, they're going to be wanting to be with their peers a lot more than with their family or with their parents. And so you want to make sure that once that time happens, that they know how to have healthy relationships and healthy communication patterns with their peers.
Yeah, it sounds to me, Michelle, like what you're saying is that while they're still young, before they enter those preteen and teen years, like you said, when they want to be with their friends more, that you establish that foundation, that really strong foundation where it prepares them to deal with the world. You want your child to be prepared to deal with the world. You don't want them to be dependent on you for everything. And so you're building that foundation from the time they're very young so that they're equipped for that.
Right, right, definitely. And I think too, it's also about doing your best to help provide your child and your youth with that supportive, stable, predictable, and home and neighborhood environment. So making sure you mentioned Adeline, parents should model having, good habits, being on a schedule, things like that. We also want to make sure our children, we instill in our children that they stick to a regular, predictable daily schedule, such as, having regular dinner times, going to bed at a certain time. And again, having that predictable environment is good for children's development. It's good for their brain development, their cognitive health, and they know what to expect. So as much as we can try to do that and also model that behavior, it's really important that we have that environment for our children.
And I think, Michelle, in your household, you're really good at following that.
Yeah, I would say like my husband and I are pretty like good about we've always ever since they were babies, sticking to a schedule. I mean, that helped us, our mental health, not feel so out of control because when kids are really young, when they're babies even, it can get really like difficult, that shift from being a couple with no kids to now having a baby. So I think for parents it helps your mental health, and it helps just have what's coming next. And then for your child, that they know, okay, around this time is we're starting to wind down, it's time for bed, or it's time for dinner. They always know they're going to have a meal at a certain time, or snacks at a certain time, naps. All of that I think is foundational for as they become older, that they have those good habits. And again, it's all fostering positive mental health.
Mhm.
Yeah. And then also, another tip is to try to minimize negative influences and behaviors in young people's lives. So, talking to kids about what's right and wrong, sharing your values, your family's values, so that your children know what's right or wrong, and then also teaching them healthy ways to cope with the ups and downs in life. So, as you're saying earlier, Adeline, we want to prepare them for the real world. The real world isn't going to be easy and smooth. There's going to be conflicts, and teaching our kids to be resilient, to face adversity, and to do so in a healthy way.
And so, a few other tips: looking out for warning signs of distress and seek help when needed. And I think when I say that, it might sound a little obvious on the surface. Well, of course, I would seek help. Of course, I would look for warning signs of distress, but they're not always very obvious. And so, some signs of distress in children, they can show up in a number of ways that are not the same as they would show up in adults. And so, irritability, anger, withdrawal, and other changes in appearance, performance at school, sleeping or eating patterns changing, other behavior changes. And I think a big key here is that if it's just a day, maybe your child teen broke up with their boyfriend, girlfriend, and they're a little sad for a few days. That's to be expected. But if you're seeing this pervasive chronic pattern that is a distinct change from how your child was before, pay attention to that, and seek that help if needed.
And I think it kind of goes back to, again, that connectedness. So if you're already the kind of person that knows your child, you're taking interest in their lives and how they are, you would notice those changes, that, hey, this is not my kid. Something's different. And then that kind of alerts you to maybe needing to seek help, or because you're already aware that there's something going on that's a change in their regular pattern.
Right. And minimizing children's access to means of self harm. So that would include, for example, firearms and prescription medications. And so, having firearms in the home, research does show that it increases the likelihood of firearm related death. But if you choose to keep firearms in the home, it doesn't mean that you can't if you have children. If you do choose that, make sure that they are stored safely, and so unloaded and locked in a lockbox or in some sort of safe that they do not have the combination to, of course, and that they don't have access to is so important. And yeah, and then one more tip is to be attentive to how children and youth spend time online. I think, Michelle, you kind of covered this a little bit, just talking about your experience, which I really enjoy hearing about how you manage that as a parent. And so, as we've already said a few times, digital technology can have positive and negative impacts for young people. So, ask questions about what they're posting and who they're following. And the intent is not to control them, but to be curious about their online activities and lives. And so I think I really like hearing about you and your daughter, Michelle, because the way that it sounds like to me is that I don't think she perceives it as you're kind of like a watchdog and you're controlling her. You already have those open lines of communication. So it's not invasive to her.
Right, right. And I think when you already have those open lines of the communication, you already have that, trusting relationship between you and your child. And when you're asking them like, oh, what are you looking at? Or, oh, who's that person you're following? It's not going to seem like you're bothering me or you're annoying me. It's like, okay, yeah, it's so-and-so and they're doing this I don't know, just dance or whatever it is. And it's just like, okay, you're just kind of getting to know what their interests are. Like, okay, so are you interested in dance or interested in a certain type of like artist or musician, music or what have you? So again, it's just being curious about your child's life and what they're interested in, and showing them that you genuinely are curious and you want to know. You want to know what's going on in their lives.
Take an interest in your children.
Yep, definitely. That's so huge. I mean, again, seems easy, but it is something that makes that pays dividends. It makes a huge change.
And it takes time and effort.
Yeah, definitely. So those are some things that parents can do, preventative measures. But sometimes with our kids, sometimes professional treatment may be needed to treat mental health concerns. So if you are looking into something like therapy for your child, therapy can help treat certain mental health conditions and also help your child manage their symptoms so that they can better function at home, at school, and in their community. So a couple of things about therapy for children and adolescents. So therapy with children often typically involves working with the whole family. So oftentimes family therapy will be involved, or at the very least, some sort of like dyadic parent and child together in the room type of therapy. And it's really important because you can't just treat the child alone. Like, the child is part of a larger community, parents, family, which is why it's always important that, parents specifically are involved in the child's treatment. And then what we'll see is for younger children, it is very common and in fact necessary for therapy to include the parent. So there's going to be sessions maybe where you and your child are involved, or some sessions where it might just be a therapist contacting you and talking to you about what's going on at home, or talking about parenting skills and expectations about your child. So that's also going to be part of the whole treatment. For older children, so adolescents, teenagers, they can often, have therapy sessions alone with a therapist. But again, the therapist would also want to probably include parents in that treatment. So maybe having, again, every now and then having like one-to-one sessions with the therapist is also common. But again, every child and family has different needs, but that is a difference between like adult therapy and child and adolescent therapy, is that just expect, some parental and familial involvement.
Yeah, and Michelle, I'd like to hear that from you, since you have worked for quite some time as a child therapist. And so here, I did it just a little bit as part of my training, but it's not what I specialize in. And so I think it's really helpful to hear that from you and why it's so important and so helpful.
Yeah, definitely. And again, you're not going to see changes if you're just seeing a child and the therapist alone. Like, really where the changes start to happen is when you're involving the parent, because then they can carry out some of those, whether it's parenting changes or environmental changes, or just kind of just shifting their perspective on parenting or their child. That's where you're going to see those long-term changes in a child's behavior or in their needs. Yeah. So in addition to individual therapy for children, group therapy can also be helpful, especially in school-age children, because then at least you're also fostering, some sort of connection between same-age peers. Children can see that, they're not alone, and that they have peers who are also going through similar things that they're going through. And then some modalities that are used for adults, like cognitive behavioral therapy or dialectical behavior therapy, those can also be used with youth and with adolescents. So those are some things that your therapist or your child's therapist might be using. So I know all of this can also sound daunting. This is a lot, especially if you are someone who's thinking like, maybe my child might benefit from mental health services. So one thing we do want to address is that we said earlier that there is a shortage of mental health services here in the US. So maybe some places that you might want to start, you can start by talking to your pediatrician or your family physician. They might have referrals for therapists within your insurance network. So that might be a place to start if you are worried about your child. And then another place you can also inquire about is your child's school or school district. So there's been a push with pushing some mental health services into the schools because our children spend majority of their time in the schools. So that might be a place to inquire about whether they have referrals for mental health services outside of the school or within the school. Some schools have like school counselors, school psychologists. There's services in place that maybe your child can get some services while they're at school. And then another resource that could be helpful is Psychology Today is an online directory to help find private practice therapists in your area. So that might be another way to find different private practice therapists in your area, and hopefully ones that will also accept your insurance. So that's also something that is something to consider.
Yeah, I actually give the Psychology Today website to my patients all the time because even though I work in a behavioral health department of a larger hospital, the wait list for therapy, I'm not sure about for children since I don't see children, but at least for adults, the wait list is about 16 months. Uh,
16 months?
16 months.
Wow.
Yeah. So about almost a year and a half. And so I always tell my patients that, it's hard. I can put in the referral for you. It will be for about a year and a half out. Someone will likely cancel, but I don't know. And so I always give that Psychology Today website as well, that online directory. And so I think that's a great resource for people to keep in mind too. And so, for some mental health conditions, medication may be needed. And so, the idea of prescribing a child or teen medication, we understand it can make some people uncomfortable. That's very valid. But under the guidance of a trusted physician, medications are safe and effective. So, what you can do is first consult with your pediatrician about psychotropic medication. So, that would be medication for mental health conditions, or consult with a child psychiatrist. Depending on exactly your insurance benefits, you may need to speak to the pediatrician first. But a child psychiatrist, if you do end up seeing one of them for your child, they can also help provide information outside of medication that may be helpful for people who are hesitant about having their children placed on medications. And so they won't just necessarily just go straight to medication. Some of them can also provide those other resources.
Yeah. And I also want to just point out, I know, it's uncomfortable to think like, oh, a young child, like a 5-year-old to be on medication. That's something that like in the work that I've done, no one has been like, yes, please put my child on medication. And I think if someone was that way, I would also have to like give some pause to like, oh, why do you want to do that so quickly? But I will say, child psychiatrists are trained to be very mindful of child development. They will, at least the child psychiatrists that I've had the pleasure of working with, will take the time to like really thoroughly observe and see, what else is going on. They're not quick to just prescribe. They will listen to parents' concerns and offer like, here's some alternative things that you can try. But if those don't work, then maybe let's, schedule an appointment and then we can kind of talk about it and see if medications might be something to try. And they would often prescribe, a very low dose and then titrate up. So it's not something where they just give like a strong dose and then your child is a zombie. Like that is never the goal. So as Adeline said, under the guidance of a trusted physician, medications are safe and effective if that's what's called for.
Yeah. And so that's all that we have for today's episode about youth mental health concerns. I'm Dr. Adeline Leon, licensed clinical psychologist.
And I'm Michelle Young, licensed clinical social worker.
And if you liked our show on the youth mental health crisis and would like to see more content like this from us, make sure to like this video and hit that subscribe button so you can get notifications when we release our weekly episodes. And we'd love to hear from you in the comments. What are your thoughts about the youth and mental health crisis? If you're a parent, have you been able to implement any of these tips that we gave, or do you see yourself implementing some of these tips that we gave in the future? We would love to hear from you, so definitely let us know in the comments.
Thanks so much for tuning in to Mental Health Merienda, your snack-sized guide to mental wellness. We'll see you next week.
Okay, bye.
Bye.